When patients come in and see us in clinics, we talk about knee osteoarthritis. Oftentimes the question is, well, how do we treat this and what are our options? A lot of times when patients are referred to come see a surgeon, their first concern is, oh great, I'm getting surgery. What I want to talk with you today about is that there's lots of different options before surgery. At Summit Brain, Spine, and Orthopedics, we don't jump to surgery right away. Our main goal is actually to treat it conservatively and have surgery be the last option. So we want to think of surgery in general as the last portion of the treatment spectrum. Over here on this part of the spectrum, we say, don't do anything versus the end of the road being joint replacement. The first thing we talk about is adjusting the physics portion of the friction that we get in our knee, which is reducing weight. So a lot of times it's not very comfortable to go to a doctor when they say, hey, we need to do weight loss surgery. But realistically, for every pound we lose with weight loss, it's 4 to 6 pounds through the joint of joint reaction forces that we can diminish and make that equation a little bit better so you don't have as much friction. Then we talk about the next on the spectrum is activity modification after weight loss. Simply put, it means if it hurts to do something, don't do it. And I know that sounds like an ad in the funny papers where you read and it says, I went to the doctor and I said, hey, it hurts when I do this. And the doctor says, well, don't do that. And yes, that is true. It is kind of funny. But at the end of the day, whenever we do something, it causes that friction and that inflammation to start and becomes this positive cascade that can last for days. So we try to avoid those things such as stairs, low squats, and things that cause that inflammation and friction to be a little bit higher. If that doesn't work, we then change by not dealing with physics, but actually dealing with the body's reaction to friction, which is going to be anti-inflammatories. So daily anti-inflammatories, ibuprofen, Advil, Aleve, meloxicam, Celebrex, lots of different medications that can target it. The job is to reduce the body's reaction to the inflammation by taking those medications. And we can talk more about that as patients come in and we see them in clinic. The next option is to do non-operative injections, which include both steroid, which is an anti-inflammatory injected locally, or a gel injection that helps to lubricate the knee. And if none of those work, at that point we talk with patients about doing the surgical options, which is a total knee replacement.